If that's okay with everybody. Okay. Thanks for joining us this morning. My name is Emily Peterson. I'm the Advocacy and Policy Manager for Milwaukee County Aging and Disability Services, and I also serve as the State Health Insurance Program Coordinator for Milwaukee County Aging. This is our virtual Medicare 101 presentation. Thank you all for joining us. In a moment here, I'll share my screen and start our presentation, but wanted to take a moment to introduce all of our presenters today who will be going through the presentation with me. First is Nina Yang. She is our Elder Benefits Specialist, specializing in Medicare counseling here at Milwaukee County Aging and Disability Services. We also have Ingrid, who is with the Senior Medicare Patrol, who will be presenting as well. Ginger from Disability Rights Wisconsin and the Part D Helpline. And then Alyssa Kolpa from the Medigap Helpline. So we have a great slate of presenters here who are experts in Medicare and are going to do a great job presenting today. Just wanted to give a little bit of background about our presentation series and let you know that our Milwaukee SHIP Collaborative brings together federal, state, and local agencies to provide timely, accurate, and unbiased information about Medicare, Medicare cost assistance, help with appeals, and fraud prevention. We are working with the Administration for Community Living and the State Health Insurance Assistance Program to provide these programs for free. And we are in collaboration with our Wisconsin Department of Health Services Elder Benefits Specialist Program. So thank you all to our presenters for helping out and taking time to present in this series. We have a series of presentations going on throughout the next few months in alignment with Medicare open enrollment. So if you have not gotten enough by the end of this presentation, which is going to be a 101 series, we have many more presentations going on over the next several weeks. So sometimes it's good to hear information more than once. And you can go to another 101 presentation that we have going on, or we have presentations that go over specifically Medicare Advantage and Part D updates for 2025. So we can also share that information out as well, so you know when those are. Today, we're going to go over the different parts of Medicare, how to enroll in and review Medicare and prescription drug plans. We'll go through Medigap policies, financial assistance for Medicare costs, and how to detect and report on Medicare fraud. So like I said, this is just our basic overview to help you understand Medicare. And we're not going to get into depth on any of these programs in particular, but we do have some presentations later on this month and next month that go over Part D and Medicare Advantage in a little bit more specific detail. We do have some resources at the end of the presentation where you can get one-on-one assistance for any Medicare needs you have, but you're able to call the Milwaukee County Aging and Disability Resource Center to get connected with our elder benefits specialist. So I'll have that phone number on the screen at the end. But there's also a lot of other resources throughout the state to get one-on-one counseling assistance. We're going to record today's presentation, and then at the end, we'll have opportunity to ask questions, which you can verbally ask by unmuting yourself, or throughout the presentation, you can type them into the chat box, and I'll be monitoring the chat to make sure that we get your questions answered. So I'm going to go ahead and share my screen with the presentation, and we will kick it off from there. And I always have to remember how to get back to where I was with the presenting. All righty. All right. Can folks see my screen okay? Okay, now I cannot see you guys. Okay, great. So again, this is an overview of Medicare presented by us here at the Milwaukee SHIP Collaborative. Like I said, we're working with the State Health Insurance Program to provide free objective Medicare counseling. Again, this is in collaboration with the Administration for Community Living, the Department of Health and Human Services, and then our State Department of Health Services. We're going to go over the different parts of Medicare, different options to receive Medicare coverage. We'll compare original Medicare and Medicare Advantage, cover Medigap supplemental insurance, go over programs you could qualify for based on limited income and resources, go over potential scams, and then also address Medicare issues. So we'll start with the basics. What is Medicare? Great question. Medicare is health insurance for people who are 65 and older. If you are under the age of 65 and have certain disabilities, and then if you are any age at all with end-stage renal disease. Medicare is administered by the Centers for Medicare and Medicaid Services. That CMS acronym that you see stands for Center for Medicare and Medicaid Services. But you're going to do your initial enrollment into Medicare by the Social Security Administration. So when it's your time to enroll, that's who you're going to go to. You could visit the local office, call the 800 number, or do it online. You could also mail in the forms to the Social Security office. Probably the easiest way to go about doing that is doing it online instead of going to the local office and waiting in that long line. But you do have the option to do any of those methods. After your initial enrollment is done, you'll be dealing with the Centers for Medicare and Medicaid Services with your health insurance, but that initial enrollment is all through SSA. If you happen to retire from the railroad board, if you happen to retire from the railroad, your initial enrollment is going to be done by the Railroad Retirement Board. A little different process for that. Medicare enrollment is automatic for those who are receiving already Social Security retirement or Social Security disability. So if that is you, you are going to have automatic Medicare enrollment. However, it is not automatic for those who are 65 and either not receiving Social Security or you are still actively working. If you are 65 and you are still covered by an employer plan, so you're getting insurance, health insurance through your employer. Before you do anything, you want to contact your HR department at your employer and see what they want you to do with enrolling in Medicare. They'll tell you how that health insurance plan is going to work in collaboration with Medicare and what parts of Medicare you may need to enroll in. Medicare may be the primary or secondary payer to your employer health plan, and they're going to be the ones who can tell you what to do in regards to enrollment when you turn 65. So when are you going to want to enroll in Medicare? Obviously, for the most part, that's going to be when you turn 65, and you're going to have an initial enrollment period that lasts 7 months. If you do not enroll during your initial enrollment period, you could pay a penalty for delaying. You can always call for assistance to find out when you should be enrolling in Medicare, especially if you have a special situation. But for the most part, you're going to want to pay attention to that initial 7-month enrollment period. And of course, we have a picture here of that red, white, and blue Medicare card, so you know. And when you enroll in Medicare, it's going to list the date that your coverage starts for both of those Part A and Part B enrollment periods. What is the Medicare initial enrollment period? Again, it's 7 months around your 65th birthday. It's going to be the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after you turn 65. So for example, if your birthday is in the month of September, the 3 months before you turn 65, June, July, August, are going to be months you can enroll, plus the month of your birthday, September, and then you'll have October, November, and December to enroll. The only change is that if you're born on the first day of the month, and then your 7-month enrollment window shifts up 1 month. So again, to receive assistance with Medicare, to get started in Medicare, look up plans and contact CMS for questions. You can go to the Medicare website, medicare.gov. When you go to medicare.gov, you can create an account. You'll be able to look at your coverage start dates. You'll be able to access information on your claims, print your Medicare card, and get other information regarding your Medicare coverage. This is also where you'll be able to look at the Medicare Plan Finder. This is super important right now during Medicare open enrollment, which lasts until December 7th. Started on October 15th, so you still have plenty of time to go on there and look at all the different plans, but this is where you'll be able to go on, compare the different plans, Medicare Advantage plans, Part D plans based on your zip code, the plan year, and all the different things you're looking for in a plan, like specific drug coverage and the doctors that you want to see. Now we'll start getting into some of the meat of Medicare, which is the parts of Medicare and how you can start to receive Medicare coverage. You've probably heard that there are the A, B, C's, and D's of Medicare, we'll start going into a little bit of these parts. So these are the first three parts we're going to cover: A, B, and D. Part A is hospital coverage, Part B, medical coverage, and then Part D, drug coverage. We're going to go into these in a little bit more depth later on in the presentation, but just wanted to start out by letting you know Part A, hospital coverage, is when you are inpatient in a hospital and seen by a doctor there. Part B is medical coverage, like when you would go in for an office visit. And then Part D is prescription drug coverage. And then Part C is what is known as the Medicare Advantage, which I'm sure you've heard a lot about, especially now during open enrollment. Part C, Medicare Advantage, includes Part A and Part B of Medicare, and oftentimes includes your Part D drug coverage as well. Not always, but it can for many plans. And it's going to include, again, that Part A and that Part B, hospital and medical. I'm going to turn it over to Nina now.
All right, thank you, Emily, for that. So I'm gonna discuss about your Medicare option. So as you can see on the chart on the left side, original Medicare, which is Part A and Part B. That is what everybody enrolls into, okay? Once you enroll into original Medicare, you would decide whether or not you want to purchase a Medicare supplemental insurance policy, also known as a Medigap policy, which fills in the gap of what is not covered by Medicare Part A and Part B. And you can also include a Part D drug plan for prescription drug coverage. That is one option. The other option you can see on the right side of the chart is Medicare Advantage plan. So before enrolling in a Medicare Advantage plan, you need to have Part A and Part B. And what Medicare Advantage plan does is that it's overseen by a private health insurance company that oversees your Medicare coverage, combines Part A, Part B, and usually it may include a Part D drug plan. That is Medicare Advantage. Next slide. So original, excuse me. So original Medicare consists of Medicare Part A for hospital insurance and Medicare Part B for medical insurance. With original Medicare, you could go anywhere in the United States and its territories that accepts Medicare for payment and services. So you have a wider network with original Medicare and you're less restrictive. Next slide. So for Medicare Part A, most individuals receive Part A premium free if you or a spouse have paid Medicare taxes long enough while working, generally 10 years. For individuals who have less than 10 years of Medicare cover employment or anyone who has not paid Medicare taxes, you can still enroll in Medicare Part A. However, you will likely have a monthly premium that you will have to owe under Part A, and that can cost you $278 or $505 each month. If you did not enroll or purchase Part A when you were first eligible for Medicare, you may have to pay a late enrollment penalty. That penalty is 10% of the Part A premium, which must be paid for twice the number of years for which you were eligible for Part A but did not sign up. So for example, let's just say that you are now 67 years old and you were supposed to enroll at the age of 65. You missed 2 years, so you will pay twice the number of years for which you were first eligible for Part A. That's 2. So 2 times 2 is 4 years. You will pay that penalty for 4 years. Next slide. So Medicare Part A covers hospital insurance. So that includes inpatient hospital care for semi-private room. You have to be formally admitted in the hospital. If the doctor comes to you and say that you're on observation, it is covered under Part B as in boy. As well, coverage for skilled nursing facility and rehabilitation is also covered after you've been admitted. and has stayed in the hospital for 3 days or more for rehabilitation at a skilled nursing facility. As well, home health services also follows that same rule too, of the 3-day admission stay, and you also have to be homebound in order to receive that service. Hospice service is also covered if 2 doctors certify that you have less than 6 months life expectancy. That is a coverage under Part A. There is costs associated with Medicare Part A. In 2024, there is a deductible that you do have to meet for hospital, which is $1,632. That deductible covers your day from day 1 through 60. If you have to be admitted beyond day 61 through 90, you will pay $408 per day. After day 90, this is considered your 60 lifetime reserve days. Once you utilize these 60 lifetime reserve days from day 91 through 150, you no longer get them back. They are exhausted, and it will cost you $816 per day. Once you exhaust your lifetime reserve days, you will be responsible for the entire cost. As well, for nursing home, it will cost you $0 for day 1 through 20. From day 21 through 100, it will cost you $204 per day. After day 100, you'll be responsible for your entire cost. And just note that with these costs, Medicare is based on benefit periods where you have been out of the facility for more than 60 consecutive days. You will start a new benefit period. Okay, next slide. So Medicare Part B is medical services. So this covers your doctor visits to the physician, so like a primary care doctor, a specialist, outpatient hospital, emergency room visits, laboratory, medical, surgical services and supplies, and occupational therapy and physical therapy. It also includes mental health services that are outpatient, durable medical equipment, preventative screenings like flu shots, as well as annual wellness visits. Original Medicare does not cover a physical. If you ask for a physical, you will be responsible for the entire cost. As well, Part B also covers ambulance transportation to the hospital or to the skilled nursing facility. Due to COVID-19, coronavirus vaccination and booster shots are free of charge. As well, if you suspect that you have COVID-19 and you need to get a test done, you will contact your provider who will order it, and you must get that test done at a laboratory in order for Medicare to cover it. Other than that, if it's not done in a laboratory, you'll be responsible for that cost. For individuals who are in a Medicare Advantage plan, those costs or coverage for a diagnostic test will be different, and you will want to look at your explanation of coverage for that. As well, telehealth visits are covered and may be free of charge through December 31st of 2025. Anybody who is using a durable medical equipment pump, you would pay no more than $35 for the insulin. And this is due to the Inflation Reduction Act that was passed in 2022. Next slide. So there is costs associated with Medicare Part B. In 2024, the Medicare Part B premium is $174.70. And usually this is automatically deducted out from your Social Security check if you are on Social Security. But if not, you will get a quarterly statement to pay your Medicare Part B premium. Individuals for a single person income over $103,000 a year will have a higher Part B premium, and a couple whose income is over $206,000 will have a higher Part B premium. In original Medicare, there is a deductible for Part B in 2024. That deductible is $240. Original Medicare will only cover 80%, so you're responsible for 20% coinsurance for most services. There's a program called the Medicare Savings Program that may be available to help you with these out-of-pocket costs. Later in the presentation, we'll discuss about the income and asset limit for that program. Next slide. So overall, Medicare does not cover routine physicals. You must ask for a wellness check. As well, most dental care and dentures are not covered. Hearing aids and fitting exams, routine eye exams for prescription glasses, most cosmetic surgery, massage therapy, most acupuncture, and long-term care are not covered by Medicare. It's important to know that. Next slide. So what is a Medigap policy? So Medigap policy, also known as Medicare supplemental policies, these are policies sold by private insurance companies. They are not part of Medicare. It's a policy that you purchase to fill in the gap in original Medicare, which can help pay for the deductibles, coinsurance, and co-payments. Just to note that when you purchase a policy, you do have to pay a premium for this policy on top of your Medicare Part B premium. It is not free. As well, individuals who purchase this policy can also receive coverage for travel outside of the United States. And in the state of Wisconsin, you will receive additional coverage for a chiropractic and skilled nursing facility. Next slide. So when is the best time to purchase a Medigap policy? That would be during your Medigap open enrollment period, which begins when you are 65 years or older or disabled and enrolled in Part B. Once you meet this open enrollment period, it will last 6 months. And that would be the best time to purchase your policy. The reason being is because you have protection. So the plan must sell you a plan without pre-existing condition tests. If you choose to wait later on to purchase a Medigap policy, if the insurance company agrees to sell you one, you may have restrictions. There's no guarantee that a plan will accept you. If you wait, cost, coverage, and availability could be affected. So just remember the best time to purchase one is during your open enrollment period within that 6-month window. As well, Medigap policy only works with original Medicare. It does not work with a Medicare Advantage plan. Next slide. So how do you find the right policy for you? So you could contact the Wisconsin Medigap Helpline at 1-800-242-1060. You can also review plans on the Medicare Plan Finder on Medicare.gov. You can contact the insurance company to get a quote or work with the insurance agent. Next slide. So the next option for coverage is Medicare Part C, also known as Medicare Advantage. So in order to enroll in a Medicare Advantage plan, you must have Part A and Part B. As well, individuals enrolled in a Medicare Advantage plan, because it's a private health insurance company overseeing your Medicare coverage, they still have to follow the same rules as original Medicare. So you still have the rights and protection. Medicare Advantage plan may also include a Part D plan, which is a prescription drug coverage with that Medicare Advantage plan. It can also include extra benefits like vision and dental. As well, Medicare Advantage plan are provider network. So with that, PPOs are preferred provider, meaning that you could go in and out of network, but you would pay more for your out-of-network services. If you enroll in an HMO, then that is a health maintenance organization where you will have to stay in network. If you go out of network, you'll be responsible for your entire costs. As well, plans are regional and all plans are not available in all counties of Wisconsin. So it's important to note that if you like to travel a lot, you want to consider whether or not this Medicare Advantage plan would be the best option for you. Okay. As well, joining a Medicare Advantage plan, you may have to pay a premium by joining this plan on top with your Medicare Part B premium. As well, Medicare Advantage plan have annual out-of-pocket limits for the year. With original Medicare, there is no annual out-of-pocket limits. Next slide. So with Medicare Advantage plan, they do offer supplemental benefits. And with that, that may include fitness to like a gym membership, vision for glasses to correct your vision, dental like dentures, crowns, fillings, extractions, hearing aids and fittings, food and meal in only certain circumstance, transportation, so rides to appointments, flex spending card or money, and coverage for Medicare Part B, where the insurance will reimburse you a certain amount to pay or help pay for that Part B premium on your behalf. So, in regards to the supplemental benefits, just note that these are supplemental benefits that a Medicare Advantage plan may include. It does not include all of this, so it's important to review your Medicare Advantage plan of the type of supplemental benefits offered, and just note that depending on the supplemental benefits, there are certain requirements for individuals to enroll in certain benefits. For example, the flex spending card, that there may be restriction on that. So it's important to note that not everybody is eligible for all the benefits, especially what is currently being advertised on TV. Next slide. All right, so I'm gonna turn this over to Ginger to discuss about Medicare Part D. Thank you.
Thank you, Nina. Um, Good morning, everyone. I'm going to talk to you about Medicare Part D, which is Medicare's prescription drug coverage. Medicare Part D is optional. No one has to enroll in Medicare Part D if they don't want to. But if you don't enroll, there may be a penalty associated with it if you decide you want it later. You must be enrolled at either Part A or Part B, and you must choose a plan to join. Now, just like any prescription drug coverage that you may have had through an employer, these plans have formularies or lists of drugs in which to tell you what medications they're going to cover. In Wisconsin, the plans are available in all counties in the state of Wisconsin. And the differences in the service areas is that each county may have a different pharmacy network. Under Medicare Part D, you will pay a monthly premium for most plans. You will pay a deductible for many plans, and also there are co-insurance amounts and co-payments that you will pay for your medications. There is extra help for those who have low income and assets to pay for their Medicare Part D costs. Just so that you know, under Medicare Part D, under the Inflation Reduction Act, as of January 1st, 2023, you would not pay any more than $35 for Medicare Part D covered insulin. That means the insulin that you take must be on the formulary or the list of drugs that that plan has, and you will pay no more than $35 for that. Vaccinations are covered under Medicare Part D, and certain vaccinations and Tdap, which is tetanus, diphtheria, and alcellular pertussis, which is whooping cough, and shingles, are covered under Medicare Part D with no cost. For 2025, there will be an elimination of the coverage gap, and there will be a cap on the amount of money a person.
You're muted, Ginger.
I'm sorry, I don't know what happened there. Emily, could you put this up big for me again?
Yeah, I had to put it down because I could not hear anymore. Something happened.
Okay,
Okay, there you go.
thank you. Thank you. Um, as I was saying, in 2025, so January 1st of 2025, just 2.5 months away, well, less than 2.5 months away, 2 months and a week away, then you will pay no more than $2,000 for your medications under Medicare Part D, no matter what the cost of your medications are. There is also a discount program that will help you pay for the medications, and there is a provision um, for a way if you have high prescription drug costs, even with the $2,000 cap, some people pay quite a bit every month for their medications, in which a person can be able to spread out the cost of their medications throughout the year. We will talk about that a little later. Next slide, please. Okay, let's talk about the $2,000 Medicare Part D cap because I know you've all heard about that. You're very, very interested in this. And how does it work? Well, the Inflation Reduction Act in 2022 had a provision to cap the out-of-pocket costs for Medicare Part D covered medications to $2,000. That means no matter what the cost of your medication is, if your medication costs $10,000 a month, you would pay no more than $2,000 for it. And once you hit that $2,000, your medication would be free for the rest of the year. Under this cap, and that means all, what Medicare Part D plans, whether it is a standalone Medicare prescription drug plan or one that is bundled with Medicare Advantage, cannot charge more than $2,000 for covered medications. The out-of-pocket costs include the deductible, copays, and/or coinsurance amounts that you would normally pay. The cost does not include the monthly premium for the plan. So if you have a plan and it costs $20 a month, that out-of-pocket cost does not include that monthly $20 premium. If you are in a plan, you must continue to pay the monthly premium because if you don't pay the premium, you can be disenrolled from your plan. And then when the cap is reached, when you have reached $2,000 in out-of-pocket costs, all the medications for the rest of the year, as I said before, will be free, zero copays. Next slide, please. Then, as I mentioned before, there is the Medicare prescription payment plan, which is a way for those who have high costs for their medications to spread that cost over the year. This also was part of the Inflation Reduction Act of 2022. And it requires that all Medicare Part D plans give the option to its members. So if you're enrolled into a Part D plan, you have this option of spreading out your out-of-pocket costs over the plan year. It must be offered by all plans, both, as I said before, standalone plans and Medicare Advantage plans. But when you're looking at this, you have to realize that in some cases, not all will benefit from joining into a Medicare prescription payment plan. Those who have low cost for their medications, say you're taking generics and they only cost you $2 or $3, $5, $10 a month, then this may not benefit you because you may wind up paying more for your medications every month than you normally would if you just went in and purchased them under the plan coverage. So, and those who have extra help with the cost of their medications do not need to enroll. And again, those who have very low costs and or have a plan where some of their medications may be a zero copay, and there are some out there, may not benefit from this also. So if you're thinking about doing this before you sign up, then talk to someone about that. Please call for assistance. We'll be glad to talk to you about it and see if it would benefit you or not to enroll in the prescription payment plan. Next slide, please. Now, now that we talked about the little differences and some of the changes, let's just go into the eligibility for this. If you want to think about joining the payment plan, any plan member can join. The earlier in the year, the better for spreading out your costs. So if your medications are going to be costing you, say, $500-$600 a month, it might be something you would consider. If you do this, you must continue to pay the Medicare Part D plan monthly premium. If you don't pay the premium, you can be disenrolled. If you join into the payment plan, you must pay that monthly bill, because if you don't do that, you can be disenrolled from the payment plan and you will still owe the past amount due. So if you do this, to be aware, you will receive two separate bills in the month, one for the plan premium and one for the prescription payment plan to pay for your medications. This plan will not save anyone money. It will not reduce the amount you would owe. It will not reduce the amount of the $2,000 cap. It is just a different way to spread out the costs. Next slide, please. So how do you enroll in this? Enrollment is not automatic. Your plan will not and cannot, by law, enroll you into the Medicare prescription payment plan without your consent. You must apply to do this, and to do that, you can fill out an application by contacting the plan. You can fill out a paper application that they can send you. Usually now the plans have an online application at their website, or you can call their customer service and enroll that way. If you are enrolling into the prescription payment plan, the plan must make a determination of your eligibility within 24 hours. It's very possible that if you walk into a drugstore to pick up your medications, that the pharmacy may say you might want to take a look at that, but that is your option, No one is going to tell you that you must enroll into the Medicare prescription payment plan. Next slide, please. So how will it work? Again, you will pay $0 for your medications at the pharmacy counter. What will happen if you are in the Medicare prescription payment plan? You will walk in, the pharmacy will hand you your medication, you walk out the door. The plan, though, will pay the pharmacy the full amount of the price of that medication, and that will include whatever your copay or coinsurance amount would have been. Then you receive a bill, and then you would have to pay the bill. So, for example, under this, what will happen is that January you have enrolled into the prescription payment plan, you go in, you pick up your medication, and in February you get a bill that says you owe X amount of money. That is the amount that you owe for the month of January. And in March, you will receive a bill that will say you owe X amount of money, and that will be for picking up your medications in February. Each month, like that. The last bill of the year will be received if you joined in January of 2025, will be due in January of 2026 because it will be the bill for the medications that you picked up in December. For those who, and this is the way it will work, for those who opted in as of the beginning of the calendar year. Next slide, please. While all of this is there are other ways for you to also take advantage of coverage and things that are available to help reduce the cost of your medications. In the state of Wisconsin, we have the Senior Care Program, which is the Wisconsin Prescription Drug Assistance Program for those who are 65 and older. It covers, many prescriptions at a lower cost depending upon your income. Anyone who is a resident of the state of Wisconsin and age 65 can enroll in senior care. There are no income or asset restrictions on this. If you are eligible to receive to use senior care, depending upon your income, you will pay $5 for covered generic drugs and $15 for covered brand name drugs. There can also be deductibles depending upon your income, anywhere from zero, it could be $500, it could be $850, and those with very high income may have to spend down on medications, their income, in order to get the benefit of the senior care program. But the good thing about this is that, as I said, no income or asset restrictions, but it is considered as good as Medicare Part D. So if a person does not want to enroll in a Medicare Part D plan because they take generics or only one or no medications at all, they can enroll in the senior care program as long as they are 65 or older and be assured that they have prescription drug coverage that is considered as good as Medicare Part D. And here you can call the Senior Care Helpline, and they're very, very good at what they do there at 1-800-657-2038. Next slide, please. Okay, so I'm going to turn this over to who's next? Ingrid?
Ginger, I'm up next.
Yes. Okay. Great, Alyssa.
All right, and then on the slide, you can see how you can choose a Medicare Advantage or Part D plan. Contacting the Milwaukee SHIP through the Aging and Disability Resource Center, Disability Rights Wisconsin with Ginger. I work with the Medigap helpline, and we also do have a Part D and prescription drug helpline. Otherwise, you can always call 1-800-Medicare or go online to the Medicare Plan Finder at medicare.gov. Next slide. Now we are going to discuss Medicare appeals and your rights as a patient. So how do you know if Medicare will cover your medical test or service? First, we're going to discuss that there's Medicare's free official What's Covered app, and that delivers cost and coverage information right on your mobile device. So now through this app, you can quickly see whether Medicare covers your service while you're at the doctor's office or the hospital, or anywhere that you can use your phone, or if you have another device that you have applications on. Of course, you can always call 1-800-Medicare. You could go online to medicare.gov, G-O-V, or you yearly get mailed your Medicare and You handbook. And so you can always use that as a reference tool for different services and coverage with Original Medicare. I cannot promote the Medicare and You handbook enough. It is such a really nice publication that you get every year in the mail that you can use for your reference. If you take anything away from these appeal slides, just know that you have appeal rights for all parts of Medicare. So if you find that an item or a service is not covered, you can appeal. There are kind of two different ways that you would follow the appeal process depending on what your coverage is. You may be someone with Original Medicare, or you may choose to get a Medicare Advantage plan where you're signing up with that private insurance company to get your Medicare through them. So if you have Original Medicare, you want to check your Medicare Summary Notice. That's also called an MSN for short. And you're going to file your appeal with the Medicare Administrative Contractor. And those are called MACs for short, M-A-C. Now, if you're with a Medicare Advantage plan, you want to check your explanation of benefits, or EOB, from that plan to see why that service was denied. Then you're going to file an appeal directly with your plan. Something to note about the appeals process is there are 5 levels. So if you disagree with any decision during any level of the process, you can generally go on to the next level and keep appealing that denial. So at each level, you'll get a decision letter with instructions on how you would move on to that next level of appeal. Now, before you would start an appeal, you may want to ask your provider or supplier for any more information to make that appeal stronger. So any information you can get about why that item or service was denied can really help you along in having a successful appeal process for you. Next slide, please. Now we're going to discuss Levanta, and they are Wisconsin's Beneficiary and Family-Centered Care Quality Improvement Organization. That's definitely a mouthful. And so Levanta would be the one that you'd want to contact if you needed to appeal a discharge from a hospital or a nursing home. So for example, you think you're being discharged too soon, or a family member may think that you're being discharged too soon, or that discharge plan is unsafe. And so Levanta is the one that you would go to appeal that discharge. You may have a quality of care concern that would be immediate. So you have a concern about your care, or you have a beneficiary complaint. So Levanta would take those complaints from you. As you can see on the slide, there is the phone number for Levanta. They do have that helpline to call. But you can also get assistance from Senior Law's Elder Benefits Specialists, or EBS. So they can help you review your rights under Medicare. They could assist you with that appeal, or if you want to file a complaint. And in order to get help from those EBS through Senior Law, you can see that intake line number on the slide as well. All right, next slide, please. Now we're going to discuss help for people with limited income and resources. So we're going to go over 3 different programs. We're going to go through Medicaid, very generally, the Medicare savings programs, and extra help. Next slide, please. So first, what is Medicaid? So Medicaid is a program that helps pay medical costs for some people with limited income and resources. Medicaid is funded by federal and state governments and is administered by each state. Medicaid can cover pregnant women and children, aged, blind, and disabled people, and some other groups. And once again, Medicaid is just determined on a state-by-state basis. So if you're eligible for both Medicare and Medicaid, we refer to these people as dually eligible, meaning you can have both Medicare and Medicaid. Now, once you're enrolled in Medicare, if you are on Medicaid, you do have to get your prescription coverage through Medicare. So that would either be getting a Part D plan, or if you choose a Medicare Advantage plan with drug coverage. So that is one thing to note if you are currently on Medicaid. Once you are eligible for Medicare, you do have to get a Medicare prescription plan for those prescription medications. Now, people on Medicaid may get covered services in addition to Medicare. So there is things like nursing home care and home health care that if you're on Medicaid, you may have some additional coverage than those just on Medicare. Like I had stated, that Medicaid eligibility is determined by each state. And so that Medicaid application process and benefits can very much differ from state to state. So in order to apply, you do need to contact that medical assistance office in that state or county you're in. And for example, a person in Milwaukee County would apply through Milwaukee Enrollment Services. So they do have that 888 phone number for you to call. You could also go in person to apply as well as the option of applying online. And you can do that at www.access.wisconsin.gov. And that is a way that you can apply online. They also do have an application for your phone. If you have to submit documents and things, that is a nice way if you're able to use a phone or go online to do that way. Next slide. Now we're going to discuss what are the Medicare savings programs. So Medicare savings programs help to provide help through the Medicaid program to pay those Medicare costs. So the Medicare savings programs can help pay your Medicare premiums, deductibles, and/or coinsurance. Now you will notice with these programs, they do have a little bit higher income and resource or asset limit than regular Medicaid programs. These income and asset limits do usually change from year to year, and each state, once again, can offer some different programs this way. So on this slide, you can see the different income and resource amounts that you could qualify for a Medicare savings program. Now, depending on where your income and assets are, may determine a different level of assistance. So with one program, you may just get your Medicare premium covered, that $174 a month. But if your income and assets are low enough, you may also have help with those deductibles and co-insurance with Medicare. So once again, if you have questions, please reach out to see and get screened for one of these programs that could really help with your Medicare costs. Next slide. All right, and then the last program. What is Extra Help? This is also called the Low Income Subsidy, or LIS. Those are both the same program. Today, we're just going to be calling it Extra Help. So people with Medicare who have limited income and resources may be able to get extra help. And this is just to pay for your prescription medication costs. You apply for extra help through Social Security. Once again, just like the enrollment into Medicare A and B, the same thing with the Extra Help program. You do also have to apply through Social Security for this assistance. Now you will be asked that information about your income and resources. And Social Security does, check through the IRS and other resources to check on that income and assets that you reported. If they have any other questions, they'll just contact you to find out or get more information. But you don't have to provide a lot of that up front. You fill out the application and sign the application that those statements are true. Now, once your application is processed by Social Security, they do send you a letter telling you if you did or did not qualify. Now, make a note that certain groups of people will automatically qualify for extra help, and you do not have to go through a separate application process to get this. So, if someone has been approved for full Medicaid benefits, you do not have to apply for extra help separately. You would automatically get that. As well as people who have supplementary security income, or SSI, you automatically get extra help. As well as anybody who has qualified for the Medicare savings programs. If you've been approved by the state to get that Medicare savings program, you do not have to apply for extra help separately. You will automatically get that. But if you do not have one of these that automatically qualify you, you do have to apply separately with Social Security. So you can fill out a paper application that they send you. You can go online to socialsecurity.gov, G-O-V, or you may go through a local organization like the Aging and Disability Resource Centers to help you apply for extra help as well. And next slide, and I believe that I'll be passing it on to Ingrid.
Thanks, Alyssa. Well, we've talked about a lot of information here, and hopefully you're all still hanging with us. But now I have the pleasure, maybe that's not the right word, to talk to you a little bit about Medicare-related fraud and scams. The Senior Medicare Patrol program is a federally funded program that provides resources and information to Medicare beneficiaries, their family members, and caregivers about how they can protect themselves from Medicare-related fraud and scams. So I'm just going to take a little bit of time today just to talk to you about the very basics of that. Unfortunately, as you become Medicare eligible, you also become eligible for all sorts of other fraud schemes. So just want you to be aware of that and to share some tips with you. So we talk about three main areas, as you can see here on the screen: protect, detect, and report. So when we're talking about protect, we really truly want you to be really careful with not sharing your personal information, including your Medicare information, with anyone who calls you out of the blue, who's someone that you've not ever met or done business with before. Unfortunately, there's lots of fraudsters out there who impersonate themselves as calling on behalf of Medicare or another governmental agency. It's important for you to know that Medicare is not going to call you. Neither is the Social Security Administration or the Internal Revenue Service, unless you've already prompted a call to those agencies and are waiting for a response from them. Otherwise, out of the blue, the person on the phone that says, "Hi, Ingrid, I'm calling on behalf of Medicare today. I just want to verify your information to make sure what we have is accurate." Medicare is going to have your accurate information. So just be very, very cautious and keep that information private. The second thing we talk about is detect. And what's really important here is that it's important for all of us, whether we are Medicare beneficiaries or not, to review our statements on a regular basis to make sure they're accurate. Earlier in this presentation, you heard about two different types of statements. If you're someone who chooses original Medicare, you would receive what's called the Medicare summary notice, which, if you're receiving paper copies, is going to come to you quarterly and provide you with an overview of all of the claims that were submitted with your Medicare information during that 3-month period. So again, it's really important to take the time to become familiar with those statements and to make sure that they're accurate. If you have a Medicare Advantage plan or for your Part D prescription drug plan, you would receive that explanation of benefits statement, or the EOB. Again, really important to review those statements as often as you receive them to make sure they're accurate. And then lastly, report. So if you ever think that something isn't quite right, you opened your Medicare summary notice and noticed claims there that didn't seem accurate, or you got a phone call and you shared your personal information and now you're concerned about what your next steps are, that's what the Senior Medicare Patrol is here for. We have a toll-free helpline that you can call. That number is 888-818-2611, and you can talk with one of our staff or volunteers to make sure that all of your information is going to be safe going forward. As you can see on the screen, you are also able to either email or visit us on the website for more information as well. Next slide, please. So just wanted to share a couple of examples with you. Maybe you're thinking, I'm not even sure what a Medicare scam would look like. And so here are some of the things that we've heard from Medicare beneficiaries here in the state of Wisconsin via our helpline. So we know that there's a lot of new Medicare card scam calls. So I kind of talked about that already. If someone calls and says, "Hey, did you get your new Medicare card in the mail? It's going to be orange, green, and yellow because the red, white, and blue card is going to expire," or "it needs to be plastic," or "the new cards have the chip reader in it." All of those things, not true. There's not a new Medicare card. So the plain red, white, and blue card that you get from Medicare upon eligibility or enrollment, that's the only card that you're going to get from Medicare. So if someone calls you out of the blue talking about a new Medicare card that you might need, just hang up the phone. They're looking for your information for other purposes. Another common scam trend that we hear about is related to durable medical equipment. So those are things like back braces, knee braces, as you can see here, catheter kits, diabetic testing supplies, most recently ostomy pouches. So these are all things that either someone will call you about, or they will simply submit claims to Medicare on your behalf without ever having any sort of contact with them. So this is where it becomes really important for people to look at their statements to make sure that Medicare is not paying for something that was not medically necessary or ordered by your healthcare provider. We hear concerns, especially during this time of the year, because it is the open enrollment period for Medicare, about misleading marketing of Medicare plans. You've probably seen some of those television commercials on right now, in between all of the political commercials, offering you the opportunity to save money or for additional benefits or savings cards, all sorts of extra benefits. And of course, we're all looking for saving money and other things that we might qualify for. So we just encourage people to be really cautious and also say, if it sounds too good to be true, it probably is. And so we really encourage people to connect with unbiased resources if you have questions about if there might be a better plan for you or that sort of thing, that we would steer people away from calling the 800 number on the television commercial and perhaps reach out to your Aging and Disability Resource Center for that unbiased support instead. Lastly, there are also scams related to genetic testing and to cancer or cardiovascular disease. So again, just be careful. We encourage you, if there's any sort of concern that you have or you hear something, talk to your healthcare provider. You have a relationship with that healthcare provider, and you and that person can discuss whether maybe there is a back brace that would be beneficial for the back pain that you're having. Or if you have a concern about genetic testing, your healthcare provider is going to be the best person to explain what your options might be and if Medicare would pay for those sorts of things. So again, steer clear from the folks who are calling you out of the blue, offering you the too good to be true things. It will end up costing you time and angst if you go down that road versus working with your healthcare provider or connecting with the Senior Medicare Patrol for additional assistance. Next slide, please. So of course, every once in a while, there are problems or issues with your Medicare plans. And, that's kind of just how things work. There's always issues with some things, but it's really important for you to know that there's assistance that's available if you do have any problems or concerns or questions with any of your Medicare plans. And many of those unbiased assistant resources are available to you at no cost. So that's something really important to take away from this presentation, is that I know all of this information is overwhelming and we're covering a lot of things in a really short amount of time. But the main thing is for you to know, and there'll be a resource slide at the end, that there are resources available to help you through all of the steps of this whole Medicare enrollment issue. Next slide, please. So just wanted to share some examples of some of the issues that we hear from folks, just to give you an idea of what might be up against. And as it says here on the slide, an insurance agent called me and convinced me to switch to a Medicare Advantage plan that would give me some free additional benefits. She told me it wouldn't cost me any more than I was already paying, but now I have a higher premium and several of my expensive medications are not even covered. Another example, called the phone number from an ad I saw on TV. I only wanted information, but I just found out I was enrolled in a new plan and my doctor is not even in the plan's network. And lastly, my Medicare Advantage plan denied coverage for a service they should have covered. What do I do now? So next slide, please, will take us through some of the important steps that you can take and resources that you can reach out to get assistance and resolution for these concerns. So the first thing is, we always encourage people, if there's a question or a concern or a problem, that you contact your plan directly. that may be the most easy and most direct way to address that issue. And many of those issues can be resolved with that simple phone call. If you aren't able to get the resolution or the assistance that you were hoping for when you contacted your plan, the next step would be for you to contact or call the Aging and Disability Resource Center in Milwaukee, or to call the SHIP helpline. And both of those phone numbers are located here on the slide. And you can also visit, if you're concerned about Medicare-related fraud, you can also visit the Senior Medicare Patrol's website for more information on preventing healthcare fraud in Wisconsin. Now I'm going to turn it over to Nina, who is going to wrap up our presentation today.
All right, thank you so much, Ingrid. So I'm going to conclude today's presentation. So we wanted to share with you guys key points to remember about today's presentation is that Medicare is a health insurance program. It is not free. There is costs associated with Medicare. As well, there are many ways to get coverage within the program. And for individuals who have limited income and resources, you may be eligible for programs out there to help with your out-of-pocket costs. As well, we as SHIP counselors, we are here to provide you with unbiased information and to also help you navigate Medicare. And yes, Medicare can be very complicated, and understanding your choices and your options, we are here to help you with that process. Next slide. So as you can see, this is the for more information of additional resources that you can reach out to. Right here, we have the Disability Rights of Wisconsin Part D helpline. We also have information for the federal resource like Centers for Medicare and Medicaid Services and the Medicare and U book. We also have the Milwaukee County Aging and Disability Resource Center, Senior Law Elder Benefits Specialist, the Wisconsin Medigap Helpline, and lastly, the Wisconsin Senior Medicare Patrol. Next slide. And thank you for our presenters today. We wouldn't have this presentation without you guys, so thank you guys all for being present. And lastly, any questions for us?
There is a question in the chat about the wellness visit versus an annual physical. So Nina, maybe, or anybody else, any of our presenters could explain the difference between the Medicare wellness visit versus annual physical.
Yeah, so with the wellness check that's covered through Medicare, it's basically a list of questionnaires that they will ask you. You're not getting any blood work done like you would with the physical. So that would be probably one of the major differences between the wellness check versus a physical. And then anybody could correct me if I'm wrong too.
You're not wrong, Nina. You are correct.
Okay, that was great.
Thank you. And then there's another question in the chat. Is it a good idea to contact my provider to see if Medicare covers their services?
Maybe Lisa, if you could explain like their services, like are you asking like what type of services? Like services in general or like the physical, I mean the annual wellness check or like a provider?
Well, I have had cancer and get a lot of treatment at Freighter, and in deciding on original Medicare versus Advantage, would it be a good idea to contact my providers at Freighter to see what, as a patient, I might have a better experience with? I guess that's really a more thorough way of presenting my question.
Yeah, so when it comes to network, so when it comes to Medicare Advantage plan, if that's the choice or option that you want to go with, before you join a Medicare Advantage plan, you want to make sure that your doctors are in the plan network. Okay, because every Medicare Advantage plan that is available out there have their own network of providers. Okay. So that's something that you want to consider before joining a Medicare Advantage plan. As for original Medicare, you will want to make sure that your provider accepts original Medicare. And I would say most providers do accept original Medicare, so you have a wider network of services. Okay. Other questions for me, Lisa?
No, yeah, that covers it. So, yeah, thank you.
Welcome.
Good presentation, by the way, everyone.
Thank you.
Yeah, really good.
Thank you. Any other questions, either in the chat, or you can go ahead and turn your camera on, unmute, and ask anything. Will the recording be posted? Yes, we will be posting the recording of this presentation on our website, which is county.milwaukee.gov/Medicare. So it might take us a little bit to get it posted, but we will get this posted in the next week. Thank you. Any other questions for us about Medicare today? Okay. Well, please feel free to use any of the resources shared if you have more individual questions, or you think of something later on about Medicare. We're all happy to help you navigate this wonderful world of Medicare, especially during this open enrollment period. Thank you very much for joining us, and I hope you have a lovely rest of your day and week. Thank you.